Icons 8 Music.
Greetings! Our usual master of Cimarrones wasn't able to be here today, so we have a special guest, MC myself, Megan Watson. Today we will be taking the streets to shatter some simulation myths. But before we do that, I will introduce you to your co-host. First of all, we have instructor Nicole Albert.
Hello, I am instructor Nicole Albert, and I'm a facilitator, simulation faculty member at the College of Nursing in Rapid City.
We also have instructor Allyson Stromer joining us.
Thanks, Megan. Yes, this is Allyson Stromer, nursing faculty and simulation faculty in Rapid City as well.
So before we introduce you to the individuals on the street with their topics, we're going to shatter some simulation myths today. As simulationists, we've heard a lot of various misconceptions about simulation, whether questions about the simulation process or full-on, let's throw a complete out-of-nowhere curveball at them. We are here to discuss these misconceptions and talk about best practice. First of all, hi, why do we spend so much time on debrief? Can't we just run one scene into the other? Help students learn instead of doing all this talking?
So Allyson here, that is a really great question. I've heard this question often from folks that are not familiar with the simulation process. And I think the best way to approach this simulation myth or simulation misconception is that it's important to remember learning doesn't stop once the scenario is over. When we look at the healthcare simulation standards of best practice, they have a whole debriefing standard talking about the importance of debriefing and the purpose of that time as a part of the simulation. And it talks about the process is used to identify and resolve gaps in students' KSAs, so their knowledge, their skills, and their attitudes. And it helps to have students reflect on how their simulation process went, and then to promote incorporation of learning into practice. So really, when I look at that definition and I hear that comment, like, why don't we just run another scenario instead of doing all this talking? We're not just doing debrief to have a chat about how the simulation went that day or in that moment. Think about it as students bring into a simulation scenario pre-existing knowledge and sometimes preconceived notions about a particular concept or about their own practice. And so we have them roll through the simulation, and then using a debriefing model here at South Dakota State University, we use the good judgment model. We help the students as facilitators to reflect on their process, to reflect on that pre-existing knowledge and on those preconceived notions often, and help them to form a new perspective, a new way of approaching a problem based on that knowledge that they're bringing into the room. So it really, when you look at the literature behind the good judgment model, it really talks about reframing a student's perspective. And that is a really important part of the debriefing process, and really the role of the facilitator is meant to help students reflect on that learning process and take learning into practice to make them safer practitioners.
And that is, great information, Allyson. And this is Nicole, and to kind of tie into that. One of the things, again, with that debriefing and reflection process is as simulationists and as effective facilitators, it's very important for us to help students not only reflect on action. So while they're in the simulation, provide insight on why they made certain decisions, what cues and things cause them to make those decisions, but then also reflecting afterwards. So, how can we take this? What will you do differently next time? How can we take it forward? How will it affect your affect or change or improve your clinical practice? Because in the end, that is our goal, is to help students as a facilitator understand why they're making these decisions to improve their clinical reasoning and clinical judgment.
Yeah, Nicole, I think you bringing up the facilitator role and the importance of helping students to be able to do that. And something that we talk about often as simulationists is the idea of helping students to feel psychologically safe within a simulation. And that reflective process is really meant to help them to gain some confidence within their skills.
Hello, my name is Svetlana. I have question for you, not quite understand. Can't you throw how you say a curveball to the scenario so you trick them to learn better?
So Svetlana, that is a great question. And I think Nicole and I both have some thoughts on this and have both looked at some literature surrounding this particular simulation myth. And I think it really boils down to how you define curveball. When you look at some literature, it talks about, as you mentioned, I'm just going to throw something completely random, not related, into the simulation to throw students off or to see how they react or help to build some sort of resilience because of this, oh, here's a new stressful addition into the simulation scenario. Nicole, thoughts from you on that?
Yeah, curveballs can be thought of areas of withholding information or also providing new information during a scenario. Sometimes this is done, but it actually directly relates to the learning outcomes. So we have to be very cognizant that this new information that we are adding is not coming completely out of left field. So it is still kind of part of the simulation. It helps students meet those learning outcomes. Sometimes withholding or adding information can kind of help create a realistic setting. But again, we always have to consider what are our goals of the learning, what are the learning outcomes for the simulation. It can't be just some arbitrary, oh, let's just add a little extra stress and stir the pot, and because that is detrimental. And also, as mentioned before, that decreases the safety, the feelings of safety for students in the simulation.
And Nicole, I appreciate that you brought up the learning outcomes, because going back to the standards, when you look at simulation design, one of the criteria with the best practice says that students have to have a roadmap. Students have to have well-defined learning objectives for a simulation. And the literature there with the best standards also talks about the idea that there might be critical pieces of information that are withheld in relationship, but they all speak back to those learning outcomes in a purposeful way. But that it'd be okay for your simulation faculty, your simulationists in a part of pre-brief to outline, here are the main things that we're going to talk about today. If it's critical thinking and it's communication and it's technical skills, those general learning outcomes have to be there for students. And as you mentioned too, students might perceive something to be a curveball, but really best practice says that those kinds of quote unquote surprises, they're probably not really surprises when we put it in that context, have to align with your learning outcomes.
Such great input thus far. Excuse me, ma'am, you look like you have a question about simulation.
Yes, hi, my name is Tabitha. I was curious, the observer role isn't as effective as active participant, right? So I can only learn in a simulation if I'm in the trenches of the simulation itself.
I'm sorry, it was Tabitha, correct?
Yes.
Okay, yes. That is a very interesting perspective, and that, sometimes is considered that, you have to be able to be an active participant to get the most effectiveness out of simulation. However, with the healthcare simulation standards, we always have a pre-briefing component. So kind of discussing what the simulation may be about, and then the simulation itself, and then a debriefing. But a simulationist or an effective facilitator really tries to tie in and make those observers have an active role. So providing those observers cues on what to consider and to jot notes about during facilitation or during the scenario kind of helps them be more of an active role. And then also it's really important that even though the student, there's maybe some people who are in the scenario doing patient care and things, and then others are observers, all people afterwards, all participants are expected to contribute and discuss during the facilitation or during the debriefing. Again, that's reflection in action. So what's going on during the scenario? So sometimes we may have the observers consider communication, teamwork, how they their peers did in completing tasks safely and effectively, how they prioritize. And then in the debriefing process, we have them provide that information too, especially because observers, active observers anyways, that anxiety level is not always there because they feel like, oh, okay, I'm not actually in it, but I do have to pay attention because I'm considering this. So it actually kind of can help them really reflect on clinical decisions that were made and have that conversation afterwards. Allyson, do you have input on this?
Nicole, I think you covered it really well, and I'll refer people back to our conversation about debrief as well when we looked at that simulation myth. But yeah, I think that having observers have that very explicit role, really having some guidance as to what to watch for within the simulation, going back to learning outcomes, it supports their learning as well. So it's not just our active participants who learn from the sim, but our observers also, as you say, they kind of get to watch from a little bit less stressful environment and then have that opportunity to reflect and take those things that are learned and reflected upon within the debrief into their own practice as well.
And this also brings up the important component of vicarious learning and also providing peer feedback. In a practice profession, it's so important that we are able to provide constructive feedback to improve upon, because especially with nursing and any practice profession, we always have to consider how can we improve our practice next time? What can I do better? How can I improve upon it? And then that constructive feedback, is a very professional skill. Kind of can also be considered, a soft skill, but it's so important in healthcare because we're working in teams. We need to be able to work as a team, be able to discuss rationally and constructively when things don't go as expected. And, the observer role, really, when it's an active observer role, is just as effective as those active participant roles. Tabitha, did that answer your question, or did you have other questions with that?
No, that did. Thank you so much. I clearly can see now that it is a valuable role to be an observer in simulation. Thank you. Oh, okay. We're going to move on to the next person here. Just one moment. Excuse me, ma'am. Excuse me. Oh, hi there. Hi. My name's Karen, don't you know? Simulation sounds great and all that, but what about virtual simulation? I've been hearing about this in the news lately. I don't love the idea of today's youth just staring at their screens playing video games all day. I know this Midwestern casserole loving mama loves some quiet time, but is virtual simulation actually effective?
That is a great question, especially in this day and age, where gaming is a big thing for kids and adults. Virtual simulation has many terms. We can call it screen-based simulation. Serious gaming is one. Virtual reality. These are all different components of applying simulation in a different modality and using technology. But even though it's different modality, it's still part of simulation. So those healthcare simulation standards of best practice are still used, are still considered, regardless of how the simulation is presented. There can be different levels of immersion and interactivity. Many can provide very realistic clinical scenarios that are, for lack of a better term, played out on a screen or using a virtual reality headset. There could be 3D glasses. So it just kind of depends on what's available and what's, useful. But again, in the end, we're looking at those learning outcomes, seeing how they relate, if this simulation can be effective in a virtual environment. One of the things too is virtual simulations, they are adjunct to other clinical experiences. So you still have in-person simulations, you still have clinical experiences, but these are just another way to help students make decisions, communicate, interact with different types of scenarios, whether it be a patient or it could be practicing a skill. As long as it's a purposeful, impactful use for learning, yes, those virtual simulations are very effective.
I agree, Nicole. I think the role of the facilitator and their approach to any of those modalities that you talked about in relationship to virtual sim is really important. If a facilitator approaches it from, we are here to meet learning outcomes, this is an opportunity to, it's a different modality. Maybe it's a space sort of an issue that we're trying to resolve. And so we're able to use, virtual sims in order to maximize some of those things and help the students to reflect upon their experiences. I think that facilitator approach is really important as well when it comes to some of those things.
Yeah, and with that too, as I said, those standards of best practice, healthcare simulation standards, you're still, for any virtual simulation, there's still a pre-brief component, reflection questions to consider before starting the scenario or being immersed in that environment. And then afterwards, it's still very, very important to have that debriefing component. Allowing students to release their feelings, provide outlet for any emotions that were coming out, and then reflect on why they made decisions a certain way. What information did they wish they had or did differently? How can they improve upon it? Again, always going back to how can we improve our care? What did I do well? What could I improve upon? What can I transfer forward to assist when taking care of patients? Do you feel a little bit better that it's not just gaming? And
I think that's okay. Yeah, I guess that makes more sense then. It seems like you know what you're doing. We want to take time to thank our participants as well as our hosts. Here's hoping some of South Dakota State University's simulationists have shattered some simulation myths you may have. Until next time, this is Megan Watson reporting.